A very common disease is called chickenpox. First of all, how do you know a kid has chickenpox? What would you say? You would look at, say, oh, this kid probably has chickenpox.
Yeah, well, we look for the classic dewdrops on rose petals, appearance of the rash. So these are tiny little shiny, what we call vesicles on top of.
Where do they start initially?
Well, they can actually start on any area of
but
the
if you're
body,
going to look, if I was going to look, what would be the first place?
We look on the
The
trunk
toes,
and,
the face, the ears, behind the ears.
They don't really follow a pattern. It's not the classic, like we see with certain kinds of rashes like Roctamon spotted fever that starts peripherally and goes centrally.
So a couple of blisters don't mean you have it yet, but it could be.
That's right.
Okay, we see a lot more blisters growing, probably.
Well, even a few blisters. I mean, you could have a partially immune child. Again, we talked about waning immunity with other vaccines, and they could have a mild case. And some babies have some antibody from the mother, and they have a mild case. So the number of lesions is not what we use. What we look at is the characteristic.
But the third or fourth day, they start getting crusty, which is classical.
That's right.
And there was great concern about chickenpox, more so about 10, 15 years ago, because there was a disease called Ray's syndrome. And it seemed to follow chickenpox if we gave aspirin. Some guy figured the sales of aspirin were the highest, in more cases, of Ray's syndrome. Pretty smart guy. Mm-hmm. And also knows the flu epidemics, which is around this time of year, and we cut out aspirin,
right,
we don't have Ray's syndrome.
Either that, or there was a virus circulating at that time that's not circulating anymore. We think it was the link with aspirin seems to be pretty solid, and the replacement of aspirin with acetaminophen to treat fever seems to have made a difference. So that we don't.
But people don't know what Ray's syndrome. The kids would get like a hepatitis.
Mm-hmm. There was
cephalitis.
That's right, the combination of liver and brain inflammation.
And there was a death rate.
Mm-hmm.
Yeah, it was scary.
Right, and after that there was another scary disease, that a secondary disease, and that was Group A strep, so-called flesh-eating bacteria or necrotizing fasciitis, which occurred from infection that could start as a very trivial superinfection of one varicella, one chickenpox lesion, and led to a couple of almost 100 deaths a year.
Now, chickenpox is dangerous if the mother's pregnant. Is that true?
The mother, you mean if the mother gets it? Yes, there is a congenital varicella and intrauterine infection that can occur.
So that's more reason you want to immunize kids. If you think it's benign, it's still, you don't want to spread to a mother. If you have one kid, you can have two kids.
That's right. Yeah.
Okay, so that's very important. Is that true? Congenital,
as well as if the mother gets chickenpox in the last few days of her pregnancy, then the baby's infection can be very severe and is what we call disseminated varicella. So that's another reason to prevent pregnant women from getting the virus, and one way to prevent it is to prevent circulation of the virus in the pediatric population.